What up, people? It is your boy C. Grant, host of the Guy Talk Pod, where we are honest, open, and transparent. We have another great episode for you gentlemen today. We are kicking off our 4-part series in self-care, something that we sometimes don't prioritize as much as we should, or we kind of prioritize it or geared towards just kind of that physical space, right? Going to the gym, maybe, prioritizing our diet, which all those things are great. But we want to talk about the different buckets through this series of what self-care really looks like from head to toe, literally from head to toe. So we're happy about our guest today and excited about the conversation. Got my co-host here, Marcus Winfrey. What's going on, brother? How you doing?
Good, man. Good. I'm excited to be here again for another great episode. Looking forward to getting this conversation going.
Yes. How was your Easter, man?
It was good, man. How about yours?
It was good. It was good, man. The kids, the baby girl, so the whole Easter bunny thing. Every store we went into, of course, they had Easter bunny, so we had to take a picture.
Correct.
Naturally, so. But other than that, it was
parenthood.
Good.
Fatherhood.
The fatherhood, right.
Exactly. Shout out to all the good fathers.
So shout out to the fathers.
Yes,
shout out to the good fathers out there, man. It's not an easy job, and we don't always get enough credit. So shout out to y'all.
Yeah.
But nonetheless, we have an awesome guest today. I am super excited about this, y'all. Self-care for men. Today we have Dr. Jon Perenack. Am I pronouncing that right?
You are indeed.
Dr. Perenack with us. Of Williamson Cosmetics, and we're going to talk about what they do, what they're doing in the space as a whole, from cosmetic to self solutions for men and women, but particularly for today's conversation for men. Thank you for joining us today, Dr. Perenack. We are excited to have you. I know that we talked about it off camera. It's seemed like 6 months in the making.
Yep.
You're a busy man, man. You do a lot of traveling, man.
I think you're doing a lot too, though. Yeah. And thanks for inviting me. I'm actually excited to be here. That should be a lot of fun.
Yes. Tell us about Williamson, kind of what you guys do, where you're located, your background, of course, all that good stuff.
Well, my main surgical suite is at the Williamson Cosmetic Center. Perenack Aesthetic Surgery. We're down on Jefferson Highway here in Baton Rouge.
Okay.
It's about a 9,000 square foot facility, and we have a full quad ASF accredited surgical suite in the office. And so we have physician assistants who do injectables, and we have estheticians who can help you take care of your skin, and then we have myself, and I do strictly facial plastic surgery, and I've been doing that for 22 years. I'm 56 years old, so
good.
We do our best, and that's what we're going to talk about a little bit. And then we have Dr. Piccarell, who's our body surgeon.
Okay.
So he does body surgery, so we kind of have that split. My background, I'm actually Canadian. I'm from Canada. Been down in the United States since 1992. I've been in Louisiana since 2000, actually since 96. Married a Louisiana girl.
Wow.
So now I'm stuck. Here I am. I'm not going anywhere.
Yeah. That kind of happens with those Louisiana women, man. Bait us in, keep us, and here we are.
Can't go nowhere.
Can't go nowhere, right? But no, that's good. Now I didn't see that in my research of Williamson. So that's pretty cool, man. So give us kind of like a a Canadian favorite food type of thing. Now that you've been in Louisiana, kind of what is?
No, Canadian favorite food is going to be back bacon.
Okay.
Back bacon and lime green jello.
Okay. Wow.
You didn't know that, did you?
I didn't know that.
And then, of course, the Hawaiian pizza.
Didn't know that either.
You know what the Hawaiian pizza is? That's a pizza that has
pineapple, right,
I never actually was into that. I actually like the meat lovers pizza. But for those who like the Hawaiian pizza, pineapple and ham, there it is.
So those are kind of the staples.
Kind of are, I guess so. Otherwise, it's pretty much the same as U.S.
Gotcha. Okay. Cool beans.
It's not like going to Iceland where there's like raw cod or something.
Oh, yeah.
Not that different.
Yeah.
Down here, everything got to be fried, extra spicy,
extra spicy.
Seasoned.
Right.
That's what we like it.
So, Doc, we start every episode off with a scripture. We're heavily, in terms of our faith, we try to encourage men to build on their faith, and of course, implement some of the practical solutions as well. Mm-hmm. So we start each episode out with a scripture that parallels with kind of the topic as well. And today's scripture is coming from Ephesians 5:29. After all, no one ever hated their own body, but they feed and care for their body just as Christ does the church. And I thought that was an excellent scripture for us in terms of self-care, right? In terms of how we should, look at ourselves from every angle, right? Not just trying to lose a couple pounds, right? Not just trying to lower our blood pressure. All those things are important quite naturally, but just kind of what that that appearance looks like, Why do you believe that self-care is important for men, being that you kind of hear more about it from a woman's perspective?
Yeah. Now, we could always go back and actually look at studies. Good studies have been done historically in sociology and anthropology that have shown that, and whatever you want to take from them, that people respond better to you if you look better. Mm-hmm. And they've even done studies where they had that babies will respond better to a pretty mother's face than what is
not so
pretty. I'm going to halt it right
here.
But the point is, and if you are going to be living a life of faith and interact with people, it kind of behooves you to look the best you can be. You don't have to look like Tom Cruise, or we went to that movie last night with Michael B. Jordan. That's a good-looking guy.
Yeah.
We don't have to look like that, but you should try and look the best you can be. And people do. Internally, you bring that in, and you live a better life if you feel good about yourself.
Yeah, no, that's good.
I think there's that.
That's good. I think it's one of those kind of, if you look good, feel good, you kind of have more confidence in the other areas that you kind of navigate in. And I think too, what are some of those things? So let's kind of talk about the. I know we talked off camera again about the surgery components, right? Mm-hmm. So what do you typically see? Is there more of this versus that people get in terms of?
Yeah, I mean, from in terms of facial plastic surgery,
mm-hmm.
A lot of times when we come in with a consult, patients will come in and they may say, "Dr. Perenack, what do I need?" I'm like, "Well, no one needs anything I do, but." With men, there is the most common procedure I do for men is upper eyelids. Mm. And so you'll see guys who will come in and their brow is low, their upper eyelid skin actually obscures their eyes, and it's almost like they're wearing a baseball cap permanently. And so an upper blepharoplasty is probably the most common cosmetic procedure I do for men. It's an easy procedure. It takes about half an hour to 45 minutes. I do like to put people to sleep so they don't feel anything. I always call my patients at nighttime, and most of my guys say, geez, it's not that bad.
Yeah.
Maybe a little itchy vision, but within a week we get the sutures out, and they can get back to work pretty quickly.
Gotcha.
Get back to working out and all the rest, all the things that your life is about. Along with that, though, I think when people come in, and guys especially, because guys, if you're like me, I can do one thing in the morning. I can brush my teeth and maybe do something for skincare, and beyond that, I'm not doing much more. My wife has a bag of stuff. And I have an aesthetic center, so we have our own line of stuff, but she still has a bag of Sephora and this and that. But guys, we don't do that.
Right.
Not at all.
But we should do something maybe. And if you have problems with acne, we get them hooked up with something that helps out with acne. We can help with acne scars. Some people will have vascularity, rosacea, any number of different things. So it's not just about surgery. It's about just looking your best and kind of getting the skin cleaned up, keeping yourself looking young, keeping your skin young, avoiding skin, because there is skin cancer out there.
Yeah. Mm-hmm.
And just doing your best with that.
Yeah.
I got a question. So I know a lot of friends that I have. We grow beards to hide those rashes and bumps and stuff up under our necks. So we keep it up like that. Is that something that we would see someone like you to help us with, to take care of?
The issue is some skin is more prone to getting thicker scars afterwards. And if you do have a problem with ingrown hairs and then it forms a thicker keloid scar, sometimes the beard is the right way to go. But if we have little issues, and how can we upgrade your skin care so that when you do shave, if you want to shave, you don't get the little bumps, you don't get the little irritations or folliculitis that can lead to scarring or hyperpigmentation. My skin, I'm not really dark, but I'm dark enough that I dinged my arm and I got hyperpigmentation right here. I've got a little dark spot. And if I get acne, it'll happen on my face. So it's nice to be able to treat that and show people how to kind of take care of that. Yeah.
being in the public, I know sometimes it's harder when you have stuff that pops up. It's like, I got to get on camera, I got to get before people and talk and all this, and I don't want those things showing or popping up on me. So, are there quicker ways that we could like fix those things or something? I know women they'll put makeup on it, cover it up or something like that, but for us, it's kind of like, man, I got this big bump in my face and I got to go talk in front of a couple hundred people.
Yeah.
So,
Yeah, that's a tough one. I mean, obviously prevention is kind of the best thing out there. So if you do have acne-prone skin, it certainly is worthwhile to get on something that can help prevent that. But we do have some tricks. Clearly we do. If you have a big event coming up and you have an acne eruption, sometimes a little steroid can do the trick, a little tiny injection to flatten it out. Sometimes we can use a little bit of light therapy to help break up the bacterial component of it.
Gotcha.
And if I have patients who have, folliculitis Barbie and it's really kind of irritating around there, we may put you on a short course of oral antibiotics because that's worthwhile. You don't have to suffer with it. That's the key, I think.
Gotcha.
Fix your mic.
Oh, gee, it was up. Sure.
So that you're not talking. You guys can start. Right?
Okay,
All
cool
right.
beans. So yeah, going back a couple of steps, Doc. Anesthesia. So, you said, okay.
Should I look over at the camera or should I mostly just look at you guys?
You can do either one, both. Combination. Like if you want to tell the audience something directly, or maybe when we end, if you want to tell me and something,
He's gonna actually find a question to ask when you look in the mic.
All right.
Like where to find you, all that kind of good stuff.
Okay, cool.
Look in the camera, I mean.
So, Doc, you were talking about those men that you, in certain procedures, they go under anesthesia.
Mm-hmm.
Is that a high percentage of procedures, or is it sometimes some procedures are more of a numbing as well? It can go that route because some folks are, are kind of have phobias about anesthesia.
Yeah, and that kind of cuts both ways, doesn't it? I have some patients who are afraid of anesthesia, and I have other people who are just afraid of me.
Yeah.
And for the people who are afraid of me, anesthesia is great.
Yeah.
So we have that offered. Upper blepharoplasty, if I had someone who was really phobic of anesthesia, well, number one, education's the first thing. If you really look at good long-term prospective studies, the risk for a healthy person to go to sleep from a half an hour up to 4 hours is really, the chance for complications about 1 in 1.5 million.
Oh, wow.
It's exceptionally safe, and that's whether you're doing sedation or you're actually doing general anesthesia. So most of the time, I think people, I understand why they're nervous about that, and so we try and talk them through that part of it. But then, the next thing is, well, what if they really don't want it? And most of the time, we can do a lot of things like bleph under local anesthesia. That's a possibility. If we're doing something like liposuction under here, you work out as hard as you can, but you still have a little collection of fat.
Yeah.
Male liposuction, and
Gotcha.
usually we do it augmentated with something called face tight, which heats the fat, tightens the skin. You can do that under local anesthesia as well.
Okay.
But it kind of depends on how nervous is the person. A lot of times the people who are really nervous about anesthesia are even more nervous about the procedure.
Right.
And so we kind of have to get them past that. The reality is most things I do, it just doesn't hurt.
Gotcha.
And afterwards, it's just not that bad. But, there's a human component. You have to keep them comfortable.
Yeah.
You want people to be relaxed in what we're doing.
You mentioned something in that around liposuction. So we both recently have gotten back into the gym, and of course we have these conversations with different men in the gym, right?
Yeah.
And a lot of men struggle with, or at least in our conversations, they struggle with kind of the chest breast fat, right? In terms of on the side or under here or whatever. You guys address those type of issues as well?
We do. Now, that's not my issue so much. I'm kind
Gotcha.
of from here on up.
Okay.
Dr. Picarello, our body surgeon, he'll deal with liposuction or body tight to help get a little tightening. I'll tell you that we do have a device called Morpheus, and it's radio frequency microneedling. And it's a device that sounds terrible, but it pokes you with little electrified needles. It heats up the skin, it heats up the fat. You can make it melt fat if you want, or you can just make it heat up skin and shrink skin. So I get to the gym, and you get to the point when you break 50 and you bend over at the beach and you see all this crinkly stuff. Yeah. And so I do Morpheus here on my abs and chest, and it does a pretty nice job of tightening up. And it works for any skin type, whether you're light-skinned or dark-skinned. And that's a nice way to do it without having surgery per se.
Gotcha.
But then, there are those procedures for body contouring for men. Guys, classically, flanks.
Yeah.
Is the big spot.
Kind of the love handles type of thing. Yeah.
I mean, there are some of the crazier things like ab etching, but for most of us, just kind of making it so we fit into our pants better.
Yeah, definitely.
Go with that.
Okay, no, that's good. So the stigmas, right? So in preparation for this episode, of course, just doing some research, right, and saw that there were not necessarily facts, but stigmas, I guess, or assumptions, opinions, in terms of these procedures, right? So most men have the opinion that this is solely something for women. Why do I need that or this if I can just maybe go to the gym, right? And I was talking to a friend about this as I was kind of telling him. He was actually supposed to come here today, but he's not here, just to kind of observe and listen. But nonetheless, thinking that it's only women that should kind of be in this space, right?
Yeah.
To whether it's facials or whether it's liposuction or whatever else like that. How do we break some of them stigmas, to help men understand that, hey, regardless of your age or even more so as you get older, these are good options for you?
Yeah, and right now the times have changed quite a bit. I remember when I started over 20 years ago, probably about 5% of my patients were men. And now it's fully 20, 25%. So it's about 1 in 4.
That's good.
A lot of male patients. And they're great guys. A lot of them are businessmen in the community. I have a lot of doctors, lawyers, you name it. Businessmen, though. That's classically the guys who come see me. But, I've had police officers, you name it, people who are out there. But, there is certainly the stigma a little bit, but it's kind of broken up over the years. And I think probably TV and the Kardashians.
Oh, yeah, that's
more than anything have been the biggest thing. And it's kind of bled over into the guys are like, I wish I could look a little bit better too, and they're all right. And then, sometimes this is kind of funny, and this is very Southern, I'll have a wife will bring her husband in, and he'll sit there next to the wife, and the wife's like, man, he needs to do something with his eyes. He needs to do something under here. He's just sitting there like, but,
I guess so, yeah.
I guess so. I'm like, man, I'll say sometimes, you want to be here? He's like, oh, yeah, no, I'm good.
Right,
and it's kind of nice. So he actually lets his wife spearhead the way so he doesn't have to break that stigma himself.
Yeah.
But he's kind of submarining it in there because it's something that bothers him.
Yeah.
And, sometimes it's tough to be courageous to go out there and do
right,
it. So,
right.
Bring your wife. Yeah, and that's not a bad idea.
My wife is actually how I ended up in you guys' office.
He was one of those men he just talking about. Whatever you say.
Like, I didn't want to do it. I was like, and then I just saw her at home, like you said, with the on her side of the bathroom sink or whatever, just with all this stuff. So she has like all this stuff at the sink. She has her own little cabinet to the left of the mirror with all this stuff. I was like, I don't want to put all that stuff on my face. You know what I'm saying? Yeah. But anyway, nonetheless, I got there, came and got the massage, and I forget the name, so I apologize for that. But it's worked awesomely. It's like a tan brownish cream. But anyway, I start to see the effects of it literally within a week.
Yeah.
And so it's been great. I can definitely vouch for the product, and that's why I wanted to use it to really, talk about that so men can know that you do have other alternatives versus, what was it back in the day? Clearasil.
Yeah.
Gosh, I was a Clearasil fan, man. I used to put like loads of Clearasil on my face.
Funny smell to it.
Yeah, it did.
I don't know what that was.
Right, I don't know what
the pink one? I don't know.
Yeah.
No, I mean, we have all kinds of different products that are tailored to different skin types.
Okay.
If it's acne, if it's brown pigmentation, so we can manage that. And then you had a facial. Oh, they're great. I should get more. Honestly, if I had more time, I'd probably do it every 6 weeks, which is kind of what my wife does. For me, it's a bit like living next to Disney World. I'm driving by every day, and there it is. Don't always get to
right.
But my skin always looks so much better when it does. The other thing for guys, classically, is Botox. The other day we were watching this show. We were watching The Chosen. I don't know if you They've watched The Chosen. Good show.
Yep.
And it's getting towards the end of one episode, and my son looks over and says, "Dad, why are you so angry?" And I'm like, "I'm not angry. My Botox had worn off." And he was not used to seeing me be able to frown. I can still frown. So I don't have facial movement, but all my Botox had worn off. So he's like, "Dad, why are you so angry?" I'm like, "Oh, Lord, I'm scowling at Jesus. It's time to go and get my Botox done." So, Botox is a good way just to make it so it's a little less frowny, keep the lines from forming. It's good preventative stuff.
Gotcha.
Yeah.
No, that's good. That's good. Especially, again, going back to some of the conversation we have with men, they just think that's like not their thing, you know what I'm saying? And so that's why I was so much looking forward to this episode, to educate men, to know that one is something that's an option for you.
Oh, yeah.
But, you need some self-pampering too, in regards to like the massages or just some of those as we get older, right? We have those kind of, wrinkles or dead spots in the skin, whatever the case may be. So and I say all that to say in terms of to the aging population, right? We eventually, all of us, going to get older. I'm 50. You said you're in your 50s. Marcus is in his 40s. What are some of the things kind of that aging population you see from men our age? Are they coming more so for, like you just said, the Botox, or is it kind of a plethora of things as they get older?
Yeah, I mean, like I said, about 1 in 4 patients in our office are men. 30s, 40s, Botox is there, a little skin care, that sort of thing. Sometimes a little injectable filler for cheeks, but not a lot. And then once people get into their 50s, now all of a sudden brows drop, eyelid skin. If you have a little bit of extra fat under here and it's starting to get a little bit, because at some point in time, some of the ligaments that kind of help hold the skin up nice and tight under here, they start to relax and they come down, and no one likes that. You're in the gym, you're lifting weights, and you see this big band.
Yeah.
Right.
If it's just a band, you can Botox it and flatten it out. If there's a little bit more stuff, maybe it's going to be a liposuction. Or if there's a lot of skin, sometimes it might be even a little lift.
Gotcha.
And I have a lot of guys who do lifts, and the thing's kind of funny. I mentioned the wives will bring them in. A lot of times the wife will have had surgery with me and had a facelift or laser or something, and then the husband has it, and the wives are always kind of angry because the guys heal quick.
Yeah.
We just heal faster. We've got thicker sebaceous skin. Generally we have a little more testosterone. We heal faster. And most of the time, the biggest issue, I have to get guys to agree to stay out of the gym for about 10 days, and then they can get back into it a little bit more. But
That's always the hard thing.
We hardly ever have free time.
Yeah,
And now
yeah.
you have something done, and you're just sitting around, and they want to do stuff.
Right.
And we get you back as quick as we can.
Gotcha.
Yeah.
What? I'm sorry. You want to say?
No, go ahead.
So ethnicities, right? So we know that, I don't know. You maybe, many assume, and maybe this is fact or not. You can kind of educate us on that piece in terms of various ethnicities that come in to get work. Mm-hmm. Is there a different approach for ethnicities or different suggestions for treatment, whether it's Botox, whether it's skin care, or whatever the, kind of those self-resolutions are? Is it a different approach for that?
It really is treatment specific. So something like Botox, no, not really. Really, you're looking, when I look at somebody who, I'm thinking about how much Botox, what are we going to treat? We talk about, what lines are we seeing? Are they making just frown lines? How heavy and how strong are the muscles?
Gotcha.
That has nothing to do with, ethnicity for the most part. But then, Asian skin responds a little differently than African American, different than I'm a little native Canadian or somebody who's like Swedish. So you have to kind of tailor what you're doing to that.
Gotcha.
And then some skin types are a little more prone to thicker scars. And I think you always have to be aware of that. Does somebody have keloids? Have they had an ear piercing and then it formed a keloid? I'm going to be very careful with what I do with surgery. Now, eyelids, never seen a keloid on an upper eyelid incision. So blepharoplasty is a pretty safe one. We start looking at tightening skin, I'm going to be we'll have a serious talk about, well, do we have keloids? Maybe we're not going to be doing incisions, and we'll do something else to kind of skirt around that problem, because you don't want to walk into something and create trouble. The whole point is to make you feel better.
Yeah, definitely.
So you have to be aware of whatever that is. But,
gotcha.
But the same procedures are good for anyone, irrespective of their ethnicity, but you have to just adjust to what you're seeing in front of you.
No, that's good. That's good, because I think, particularly, education is always, key, right? Mm-hmm. So, I think sometimes people may see, the good outcome of a procedure, but not necessarily kind of what the journey was and who can actually fit in that bucket. You know what I'm saying? So I think that's good for our male audience to know that it's not a white, black, Asian, Canadian, or thing. It's truly a self-care thing.
Yeah, it really is.
In terms of what you need and finding that doctor and facility that you trust more than anything. So no, that's really good. Now, one of the things that again that I was kind of thinking back as I was preparing the questions. From your perspectives as kind of, not kind of, but as a surgeon and as a leader within your facility and have staff who report to you and whatnot, how does this type of care really affect how men show up, right? In meaning that, so I may get this, hypothetically, I may get Botox because I have wrinkles, right? But then they have other men that just need things because they just simply want to look good. Wrinkles may not be their thing.
Right.
They just want to look good. I'm getting a little older. Again, I have the breast fat kind of going on with men and stuff like that. Have you seen where men have maybe kind of came back with their testimonials, so to speak, and said, hey, man, doc, thank you. This really helped me. I don't know, get noticed by my wife more, or get noticed by my girlfriend more, or how I show up more confidently in the business meeting, things of that nature.
Oh, absolutely. I mean, it makes a big difference in people's confidence. And we're in Baton Rouge. We're not in South Beach. We're not in Newport, California.
Yeah.
People want to fly under the radar.
Yeah.
But they really appreciate the fact they look better. And they'll say, people come in, they think I've lost weight. They think are you working out? So they don't know that I did a facelift.
Right.
And they may have had skin down to here, and now their jaw's up nice and tight. Everything looks good. They don't have the Jerry Jones or the Kenny Rogers look. They look like themselves.
Hey, man, I'm a Cowboys fan.
How's the draft going?
Bad for all of us.
Right. Saints are being Saints again.
Exactly.
But the guys will notice it. They don't say a lot, except that they feel good about it, and that's the kind of thing that guys will do.
Gotcha.
They generally like to fly it under the radar. I have a harder time getting guys to let me use their photos, but yeah, they're happy patients. They really are.
Cool beans. Yeah. No, that's good.
As forms of affordability, let's say we have a guy, just a regular everyday Joe. He wants to use some of your services. Like what kind of affordability is it?
Well, Botox. If we're talking about Botox, it kind of depends on the treatment. So Botox is one of those things where guys will come in, and most of the time we're treating frown and maybe crow's feet, and you're looking around $300, $400 to treat that area, and guys seem to do it twice a year. If you really want to maintain it, 3 times a year tops, and then you're done with it, and that's just easy peasy kind of way to look at it.
Not a bad investment.
If you think about it, every day I go to CC's Coffee and I get a $6 mocha. I know it adds up to more than Botox does.
Of course.
Yeah.
So it's kind of like that. If we're talking about surgery like blepharoplasty, it's kind of more in the $3,000, $4,000 range. So it's a bit more. But it's like buying a car for your daughter. Not a car for yourself. We were talking about cars earlier. It's something that's going to be yours.
Yeah.
And if you do a blepharoplasty, that is a one and done operation. In 22 years of doing what I do, I can probably count on 2 hands women who've had a blepharoplasty where I had to go touch it up, and I've had thousands of patients. I can't think of a single male patient that I or anyone else has done an upper or lower blepharoplasty that I had to touch it up.
Oh, wow.
It just stays. It just does a great job. Similar to liposuction, once the fat's gone, it's not coming back. That's just a great investment. So if you have a big, heavy neck and it's not a lot of skin elasticity, liposuction is just great. And do it when you're younger because African American skin has great elasticity. The lighter your color your skin usually gets a little bit more loose, but it bounces back quick. So it's worthwhile doing it, even into your 40s, just plain liposuction. Things like lifts, again, if people who love their lift, they may come back in 10 years and do it again, but most guys, their lift lasts a long, long time. They're kind of a one and done.
Well, that's good. That's good.
It's a good investment from that standpoint. Yeah.
It made me think about too your products. So, and I apologize, I can't forget. I just know that it works, y'all. I'll come back with the name. I can't remember the name right now. I just remember that one was in a kind of white and tan box, and the cream itself was tan. Then, and my wife, I think, had like this gorgeous blue box, like a royal blue box.
Yeah, that's the ZO product.
The Z, yeah,
line.
Z, yeah.
Yeah.
So, are those? Can men go that route initially for certain things?
Oh, absolutely.
Okay.
Absolutely. All right. And really, even into your early 30s, I think that's worthwhile. Probably when you're in your 20s, you're fine unless you're dealing with acne or something along that line.
Gotcha.
But in your 30s, just to do a little bit of protection against sun damage, because that's where most lines and wrinkles come from. Sun damage has a lot to do with where your pigmentation comes from. So you can do little things in your 30s or 40s. And like I said, we are not going to give guys a big bag of stuff at home because, like I said, I can do one thing.
Yeah, that's right.
Maybe two, and that's pushing.
Right.
I am not doing more than that. And brushing my teeth.
Yeah,
and so you should kind of look at it like that. It's like brushing your teeth. I mean, how often do people floss? I don't know, but if you can get yourself to do one or two things, your skin's going to look so much better for a long, long time.
Gotcha.
It's just a good investment. In
Yeah.
yourself.
So our last question, and this is for obviously for the men, of course, but those that are considering Botox, right? But not necessarily abreast or maybe fearful. Maybe they don't have a wife to strongly push them and encourage them to do it, or significant other, what have you. What are some of the things that men can look for that, hey, this is something you want to at least come get a consultation around? Is it something they should look for in terms of their facial features or body features that should trigger them to come say, let me go have a conversation around this?
Well, a lot of times when I have my initial consultation with somebody, I'll walk in and I'll say, hey, I'm Jon Perenack. My coordinator told me a little bit about you, but what brings you in? What bothers you? If you have something, if you have deep lines, or you're feeling it just looks a little too frowny, a little too angry, or you just look, people are always saying, hey, why are you tired? And you're not tired. Or maybe you are tired and you don't want to know about it.
Yeah.
If those things bother you, come on in. Or if you're not quite ready to come in, why don't you spend time on our Instagram or our Facebook? Because we have some really good videos where we've treated people with Botox. You can kind of see how easy it is. You can kind of see the before and after in video, which is always which is kind of nice to see. And you can say, oh, that kind of looks like me. And then they're like, oh, that looks pretty good if that was me afterwards.
Right,
give it a shot.
yeah.
The good news about Botox is that, it lasts for about 4 months. So if you love it, well, if you don't like it, well, it goes away.
Right.
But the problem is everyone loves it.
Yeah.
Because it really does work. It's been around a long time. It's been around since like the 70s almost. And it does a great job of helping with lines and wrinkles. And it's an easy thing to try out.
Yeah. No, that's good. I know I'll be a repeat customer. Like I say, that it worked out. And my wife, she visits you guys frequently. So, no, Dr. Perenack, it's been great speaking with you. I think this was awesome. We would definitely like to have you back on.
Oh, yeah.
As Marcus and I kind of, you'll probably be seeing us in one of the facilities. I live in Gonzales, and Marcus lives in Baton Rouge, but we'll figure out which location we'll come and kind of have a partner treatment or whatever, massage, whatever the case may be. And shout out to Megan. Is that Megan?
That's Brooke.
Brooke, I'm
Brooke
sorry.
over there.
Shout out to Brooke, y'all. Y'all can't see Brooke. Can we span to Brooke? Brooke has been my point of contact, y'all. She has been awesome and very professional, and we finally got it done. So shout out to Brooke. Thank you so much, Brooke. Yep, so that's it, Doc. Tell the folks where they can find you, where your locations are, Instagram, Facebook, all that good stuff.
Yeah, well, we have 3 locations. We have one in Lake Charles. We have one in Gonzales, which you've probably been to. Then we have the one in Baton Rouge at 8150 Jefferson Highway. The surgery is at the Jefferson Highway office. We have a surgeon who's actually just beginning up in Lake Charles, so we're in those locations. Brooke, do you remember what's all my social media? WilliamsonCosmeticCenter.com. And Dr. Jon Perenack.
Yes, nice, nice.
Thank goodness I have younger people who.
I'm telling you, man.
Keep track of all this.
Man,
stuff.
I lean on mine all the time.
fun.
Yes.
Dr.
Dr.
Jon
Jon
Perenack,
Perenack, yes,
Instagram.
yes.
That's just good video stuff.
Yes, awesome. It really is, yeah. So thank you guys for joining. Look, self-care is not selfish. It is a way of stewarding yourself, your body, your mind. So we encourage you guys to go out, take the next steps into what self-care looks like for you, right? In terms of whether it's health, whether it's cosmetic, whether it's non-cosmetic, whatever that looks like. But take care of yourself in this season of your life because it will pay off tremendously down the road. So stay tuned. We have more episodes to come around self-care. Thank you, Dr. Jon Perenack, for joining us. Again, this has been the Guy Talk Pod, where we are honest, open, and transparent. Thank you guys for joining. Till next time, peace.